You are over 70, and your doctor just celebrated getting your blood pressure down to 120/80. I need you to stop and watch this before your next appointment. Because a landmark study published in the Journal of the American Medical Association tracked 15,242 seniors for 5 years. And what they found contradicts everything you have ever been told about blood pressure targets. The seniors with so-called perfect blood pressure, the ones hitting that textbook 120/80, had a 28% higher risk of serious falls requiring hospitalization. And their mortality rates were actually worse than seniors with moderately higher numbers. Let me say that again. The seniors with perfect blood pressure were dying at higher rates than those with higher numbers. In the next few minutes, I'm going to show you the exact blood pressure range associated with the longest survival in older adults, why the standard target may be genuinely dangerous after age 75, and one simple test you can do at home tonight that could prevent a devastating fall. I'm Dr. James, and this information could save your life, or the life of someone you love. Before we go further, drop a comment right now with just your age. Nothing else, just your age. I want to see who is watching this, because the information I am about to share applies differently depending on whether you are 65, 75, or 85. And if you have ever felt dizzy when standing up from a chair or getting out of bed, add the word dizzy to your comment. This is critical information I need to see, and you will understand exactly why in about 3 minutes. Here's what is happening in doctors' offices across this country right now. A 78-year-old comes in for a checkup. Blood pressure reads 145/86. The doctor pulls up the standard guidelines, sees the target of less than 130 systolic, and immediately reaches for the prescription pad. One medication gets added, then another. Over the next 6 months, that blood pressure comes down beautifully, 124/78. The doctor is pleased. The patient gets a gold star on their chart. Everyone thinks this is a success story. But here is what the guidelines don't account for. That same 78-year-old now stands up to go to the bathroom at night, and their blood pressure drops from 124/78 down to 88/56 within seconds. Their brain is not getting enough blood flow. The room spins. They reach for the wall but miss. And suddenly we are not talking about blood pressure numbers anymore. We are talking about a fractured hip, emergency surgery, 3 weeks in rehabilitation, and a cascade of complications that too often ends in permanent loss of independence, or worse. This scenario plays out thousands of times every single day across this country, and it is preventable if we understand that blood pressure targets need to be individualized based on age and functional status, not applied universally from a guideline written for middle-aged adults. Here is the part that is going to sound counterintuitive. Stay with me, because this is where everything changes. For decades, the message has been simple. Lower blood pressure equals better health outcomes. And for middle-aged adults, people in their 40s and 50s. That is largely true. Getting blood pressure under control in midlife prevents heart attacks, strokes, and kidney disease. The evidence is solid. But something fundamental changes after age 75. The research shows that seniors with systolic blood pressure between 130 and 145 actually live longer than those with pressure below 120. They have fewer falls, fewer fractures, fewer hospitalizations, and better cognitive function. The group that achieved that textbook perfect 120/80, they had higher rates of dizziness, syncope, that is the medical term for fainting, acute kidney injury, and yes, higher mortality rates. The surprise was that very low pressure was just as dangerous as very high pressure. The sweet spot, the range associated with the longest survival and best quality of life, was higher than conventional guidelines recommend. And most doctors haven't seen this research yet. Most patients have certainly never heard about it. That gap between what the research shows and what is happening in everyday medical practice is costing lives. The 3 changes that make seniors different. If you value understanding the why behind the numbers, not just being told what to do, then what I am about to explain will give you a completely different framework for thinking about blood pressure management as you age. Your cardiovascular system at 75 is not just an older version of your cardiovascular system at 45. It is fundamentally different in 3 critical ways. Change number 1, arterial stiffness. As you age, your arteries become less elastic. Think of a new garden hose versus one that has been sitting in the sun for 20 years. The old hose is stiffer, less flexible. Your arteries undergo a similar process when your heart pumps blood into stiff arteries. They cannot expand and absorb the pressure wave the way young flexible arteries can. This means you need slightly higher baseline pressure to ensure adequate blood flow reaches your brain and kidneys, especially when you're standing upright and blood has to flow against gravity. Change number 2, baroreceptor function declines. Baroreceptors are tiny sensors in your blood vessels that detect pressure changes and instantly signal your brain to adjust. When a young person stands up, their baroreceptors detect the pressure drop within milliseconds and trigger compensatory responses. Heart rate increases, blood vessels constrict, pressure stabilizes. But these baroreceptors become less sensitive with age. They respond more slowly. So if your baseline blood pressure is already low and your baroreceptors are sluggish, you get that dangerous drop in pressure when you stand. That is called orthostatic hypotension. And it is responsible for more falls in older adults than almost any other single cause. Change number 3, medication metabolism changes. Your kidneys and liver don't clear medications as efficiently at 75 as they did at 45. A dose of blood pressure medication that is perfectly appropriate for a middle-aged person can be excessive for an older adult. The medication lingers longer in your system, has stronger effects, and can push blood pressure too low, especially when you stand up at night. These 3 changes working together explain why the same blood pressure target that protects a 50-year-old can harm a 78-year-old. What the research actually found. Let me tell you exactly what this research found, because the specifics matter. The study, published in JAMA Internal Medicine, followed 15,342 adults over the age of 75 for an average of 5 years. I want to pause here for a moment, because what I am about to share next is the part of this conversation that most people never get to have with their doctor. A simple 3-minute test you can do at home tonight. A test that could tell you whether your blood pressure medications are currently putting you at serious risk for a fall, and it costs nothing. It is called orthostatic vital sign measurement, and most doctors are not doing it routinely, even though every piece of research suggests it should be standard practice for every patient over 70 on blood pressure medications. Here is exactly how to do it at home tonight. You need a home blood pressure monitor, available at any pharmacy for around $30. Step 1. Lie down flat on your bed or couch for 5 full minutes. Just rest. Let your body settle completely. Step 2. After 5 minutes, check your blood pressure while still lying down. Write down both numbers, the systolic and the diastolic. Step 3. Now stand up and immediately check your blood pressure again while standing. Do not wait. Check it right away. Write down those numbers. Step 4. Compare them. If your systolic blood pressure dropped by more than 20 points, or if your diastolic dropped by more than 10 points, you have orthostatic hypotension. This is a red flag. This means your blood pressure medications may be too strong for your physiology, or your target blood pressure may be set too low for your age. Let me give you a specific example, so this is completely clear. Imagine your lying blood pressure is 125/78. Looks perfect on paper. But when you stand up, it drops to 98/64. That is a 27-point systolic drop. That is dangerous. Your brain is receiving inadequate blood flow every time you are upright, which is most of your waking hours. You might feel fine lying down, but when you're vertical, you're operating on insufficient pressure. This is the test your doctor should be performing at every single visit if you're over 70 and on blood pressure medications. If they are not doing it, you can do it yourself tonight and bring the results to your next appointment. It is called orthostatic vital sign measurement, and most doctors are not doing it routinely, even though every piece of research suggests it should be standard practice for every patient over 70 on blood pressure medications. Here is exactly how to do it at home tonight. You need a home blood pressure monitor, available at any pharmacy for around $30. Step 1. Lie down flat on your bed or couch for 5 full minutes. Just rest. Let your body settle completely. Step 2. After 5 minutes, check your blood pressure while still lying down. Write down both numbers, the systolic and the diastolic. Step 3. Now stand up and immediately check your blood pressure again while standing. Do not wait. Check it right away. Write down those numbers. Step 4. Compare them. If your systolic blood pressure dropped by more than 20 points, or if your diastolic dropped by more than 10 points, you have orthostatic hypotension. This is a red flag. This means your blood pressure medications may be too strong for your physiology, or your target blood pressure may be set too low for your age. Let me give you a specific example, so this is completely clear. Imagine your lying blood pressure is 125/78. Looks perfect on paper. But when you stand up, it drops to 98/64. That is a 27-point systolic drop. That is dangerous. Your brain is receiving inadequate blood flow every time you are upright, which is most of your waking hours. You might feel fine lying down, but when you're vertical, you're operating on insufficient pressure. This is the test your doctor should be performing at every single visit if you're over 70 and on blood pressure medications. If they are not doing it, you can do it yourself tonight and bring the results to your next appointment. So what should your blood pressure actually be? Let me give you the ranges that research associates with the best outcomes for different age groups. These are guidelines, not absolute rules. Your individual target should always be determined with your doctor based on your complete medical picture. For adults aged 65 to 74, who are generally healthy and active, research suggests a systolic range of 130 to 140 is reasonable. This provides cardiovascular protection while maintaining adequate blood flow to organs. For adults aged 75 to 84, who are relatively healthy, the evidence supports a systolic range of 135 to 145. Notice, this is higher than the younger group. This accounts for increased arterial stiffness and slower baroreceptor responses. For adults over 85, or those who are frail regardless of age, a systolic range of 140 to 150 may be most appropriate. At this stage, preventing falls and maintaining quality of life often takes priority over aggressive blood pressure lowering. And what about that bottom number, the diastolic? For older adults, diastolic pressure should generally stay above 65, ideally between 70 and 85. Very low diastolic pressure reduces blood flow to the heart muscle during the relaxation phase and can cause serious problems. If your diastolic is consistently below 60, that is something to discuss with your doctor immediately, even if your systolic looks fine. Let me show you how different two people the same age can be. Both are 81 years old, both have blood pressure reading 158 over 88, same number, same age, but completely different situations. The first person has mild heart failure, chronic kidney disease, and osteoarthritis. They are managing multiple conditions simultaneously. The second person is healthy, active, plays golf twice a week, and has no significant medical problems. Should they both be treated the same way to reach the same target? Absolutely not. For the first person, starting aggressive blood pressure medications carries significant risk. Those medications could push pressure too low when standing, could worsen kidney function, could cause dizziness, and increase fall risk, which, with osteoarthritis and heart failure, could be catastrophic. A more reasonable approach: lifestyle modifications first, then, if medications are necessary, a low dose of one medication with careful monitoring, accepting a target of perhaps 140 to 145 systolic, rather than pushing aggressively toward 120. For the second person, or with a healthy 81-year-old, lifestyle changes alone might bring pressure to 145 over 84, which, for a healthy person that age, may be perfectly acceptable without any medications at all. Same numbers, different people, different approaches. This is called treating the patient, not the number. And it is the conversation you deserve to have with your doctor. Here is exactly what I want you to do starting tonight. First, if you are over 70 and on blood pressure medications, purchase a home blood pressure monitor if you don't already have one. Check your pressure at the same time each morning and evening for 2 weeks. Keep a written log. This gives your doctor a far more accurate picture than occasional office readings. Second, perform the orthostatic blood pressure test I just described. Lying down 5 minutes, check pressure, stand up, check immediately. If you find a drop of more than 20 points systolic, write it down and bring it to your next appointment. Third, assess your symptoms honestly. Are you experiencing dizziness when standing, unexplained fatigue, difficulty concentrating, foggy thinking? These might be signs your blood pressure is being pushed too low, even if the numbers look perfect on paper. Fourth, schedule an appointment with your doctor specifically to discuss your blood pressure target. Not just a routine checkup, a focused conversation. Bring your home blood pressure log. Bring your orthostatic measurements. Ask directly, what target is appropriate given my age, my other conditions, and my functional status? Do not simply accept a blanket target of 120 over 80 without that conversation. Fifth, if you are experiencing side effects from blood pressure medications, dizziness, fatigue, brain fog, speak up. Do not suffer in silence. Doses can often be adjusted, medications can be changed, targets can be modified to improve your quality of life while still providing cardiovascular protection. Here is what you now know that most people, including many healthcare providers, do not fully understand. Blood pressure targets should never be universal. A 45-year-old and an 85-year-old should not be held to the same standard. For older adults, especially those over 75, systolic blood pressure in the range of 130 to 145 is associated with the longest survival and best quality of life. Below 120 increases risk of falls, orthostatic hypotension, kidney injury, and cognitive decline. Above 150 increases cardiovascular risk. The sweet spot is in the middle, and now you know exactly where that is. You have learned how to test for orthostatic hypotension at home tonight. You have learned the physiological reasons why seniors need different targets. And most importantly, you now have the language and the knowledge to have an informed conversation with your doctor. You are not a passive recipient of medical advice. You are an informed participant in your own care. And that changes everything. Drop a comment right now saying informed if this video gave you clarity, if it answered questions you have been carrying, if it gave you the confidence to advocate for yourself at your next appointment. Share this with someone you love who is over 65 and on blood pressure medications. Because somewhere right now, someone is being pushed toward a target that is quietly putting them at risk. Give them the chance to know better. Subscribe to this channel. I post every single day because your health after 60 cannot wait. This is Dr. James. Take care of yourself.